I am really, really excited today to have this conversation. We are starting a new service out of Tennessee State University that will be in partnership with the health center, and it will be telehealth services for students. This is exciting for a multitude of reasons. The first being that it allows us to have additional support for the health center, but also because it supports after hours, weekends, in between break support for students who may or may not have access otherwise to healthcare support. All of the information about how it works and what it does and how you'll be able to access it, Dr. Dorsha James and Judge Rachel Bell are on the call. They are the founders of My Urgency MD, which is the program that will be providing the telehealth services for Tennessee State University. And so I'm going to turn the floor over to them for their presentation. We purposefully have included you all as student leaders and student representatives because, number one, we want you to pass this information along. There's no better way to get the word out than through you, peer to peer, as not only a part of your conversations, but your platforms as well, that this service exists. It's the first of its kind at an HBCU. We're very, very excited about it. So please feel free to ask whatever questions you have to make sure that the information is clear so that you can pass it along as clearly and as accurately as possible. So I'm going to mute. I'm going to turn the floor over to Dr. Dorsha James and Judge Rachel Bell. And thank you both so much for being here.
Thank you for inviting us. As she said, my name is Dr. Dorsha James. I am an ER trained physician. I practiced emergency medicine for 15 years. Kind of stepped away and, to use my favorite word, pivot away from the emergency department, to start this company along with Judge Bell. We, especially, I saw the need for services to treat urgencies instead of emergencies. And so what that means is people will come to the emergency department and, we think emergency, that would be the only reason that people would come in, except they weren't really emergencies. They were urgencies, things that could have been seen over the phone or seen via video. And so in 70% of all the visits to primary care offices, those visits could have been handled either over the phone, via email, or via video. So, seeing the need, the technology's there. A lot of people are now more technologically savvy when it comes to their phones. That's how this company got started, amongst other things. I'm going to introduce two people to you. These people are instrumental in the company and will be, assisting in various ways. We first have Judge Rachel Bell. She is the Chief Operational Officer and the Marketing Strategist of My Urgency MD, and I'll let her just say a few words.
Good evening, everyone. I'm excited that you are able to be on this Zoom call with us today to learn more about the telemedicine services that are being provided to TSU University, Tennessee State University. So we're really excited to have this opportunity. We're kind of the 21st century version of a house call. Many of you are young, and so you are apt and using different tools from your cell phone and from your tablets. But we're here for when life sends you urgencies and not emergencies. And so we're just going to give you a presentation today to show you and talk to you more about how to use it from your dorm, from when you're vacationing, and even if you're not in Tennessee or on campus at Tennessee State University, we know in a couple of weeks y'all will be going back home. And so anywhere in the country, you'll be able to use this, all 50 states plus Puerto Rico. So thank you for the introduction. I'm also going to talk to y'all about legal things here and there, because I know a number of you need to have insight about various different things that are going on in your life. So we're here to kind of give you more insight as well, not just telemedicine. So we kind of call ourselves where the law meets medicine, giving you a little bit of law, a little bit of medicine. But today's focus is about telemedicine and the opportunities to work with the University Health Services.
Okay, thank you. And then next we're going to have Courtney. She is our Director of Campus Engagement. I believe that she's on this call. Hopefully she is.
Hi, yes, I'm here. Can you hear me?
Yes, we can hear you. If you'll just introduce yourself and tell your role, please.
Yes, I am Courtney. I am the Director of Campus Engagement, here to Told all the students about the services that we offer, help them learn how to access it, and be of any assistance between the students and the company.
Okay, thank you very much. So I'm going to go into this presentation. This is not going to take long. I can usually get through it in about 7 minutes, 10 at tops. It'll give you a brief overview of what the service looks like. And then I'll give you a quick demo of what the portal looks like, just so that you can be familiar with seeing it. And so, like I said, this won't take long at all. So if I can share my screen, hopefully.
And while she's pulling that up, if you have any questions, put those in the chat area. We'll make sure to address those questions that you have and give you those answers as well. Maybe during the presentation. If not, we'll make sure to get those answers to you later today if there's some that we need to give you some more information.
Okay, so we'll go ahead and get started. Like Dr. Davis said, we are very, very, very excited about this partnership. We have provided services to nonprofits, small businesses, and we really, really have a heart for HBCUs. We have family that has graduated from TSU, and so we were super excited to be able to offer this service to Tennessee State University, and so we're just really elated that that they decided to partner with us, and we know that this service will be very useful for you as students as a semester and as the years go by. Okay, so not many of you may have heard about this new telemedicine platform. It's just, just revving up. So what is telemedicine? So telemedicine is a way to see a provider. In our case, it's going to be doctors. There's no nurse practitioners or nurses that are answering these phone calls. You can see them from anywhere. Like Rachel said, you can see them if you're in California on spring break, if you were in Massachusetts back at home for the end of the semester. There's no holiday breaks. There's no, blackout periods. It's to be available when the student health center isn't available to you. It's 24/7, 365. If you get sick on Christmas, you can also be seen. Like we said before, it treats urgencies, not emergencies, but we'll get to that in just a moment. So, you kind of think about what options do you have if you're out of town, you live off campus, or you're taking classes online, and you can't get to the student health clinic, which definitely is paid for by your tuition and accessible to you. Or what if it's a few days you don't feel well, you need a note for work, you need to see a doctor, and so it's a few days before you can actually get in to be seen at the University Health Services. Or like I said before, what if it's on the weekend? What if it's after hours? What do you do then? Well, that's where we come in. We've partnered with the university to offer this service 24/7, 365. And so this is how it works. So let's say, for instance, you wake up with just something as simple as a runny nose, congestion, you might have a slight fever. You're not really sure if you need to be seen in the ER. And if you have insurance, you might have a copay. If you don't have insurance, then you'll get this extremely high ER bill. So you want to know if it's something that you should be worried about, or you may know what it is and you may need a prescription for something. So and the university center is closed or you're out of town. So what would you do? So hopefully over the next few weeks, you'll start seeing flyers. You decide to try it out after you've registered. You want to know more about it. And you want to know, well, what do they treat? Can I see them? When would I use them? We can see everything you would go to an urgent care clinic for. Now, of course, we can't stitch you up. We can't do any procedures, but the one good thing about it, besides the convenience and the cost effectiveness, is that you're talking to a doctor. So that means that they can look at you, they can tell you whether or not they feel like you're sick enough to go somewhere, because you want to justify going to the emergency department, for a variety of different reasons. You may sit in the waiting room of the ER for 6 to 7 hours to see a doctor. I've had that happen before. I've had patients wait to see me for that long, especially if it was something that wasn't emergent, if it was something that was just an urgency. Our doctors can provide prescriptions. So let's say, for instance, you think you have a Sinus infection, you talk to them, they give you, you give them all the right answers to the questions, and you need an antibiotic prescription or you need a nasal spray prescription, they can actually call those into the pharmacy. And they can also give a work or school note at their discretion as well. So, sometimes you don't feel well enough to go into work. Some jobs are requiring work notes. They will be able to offer those as you need it. So it's very, very convenient, able to be used all the time, but then able to bypass getting in your car, driving to the hospital or to the urgent care clinic, and then driving to the pharmacy. This way you can just get in your car and go directly to the pharmacy if that's where you need to go, or they can kind of tell you home remedies and things like that that you need to do. We have an via email, and I don't think we have a slide for that, but you can also contact doctors via email. We have 9 different specialists. And this is if you just kind of have a question. I'm not sure if you do it, but a lot of my family members, and I tell them not to, will Google their symptoms and come up with a diagnosis and call me and then ask me if they're about to die because they have this horrible, horrible illness. So sometimes Dr. Google can lead you astray. And so you want to be able to ask a real doctor in real time and get a personalized answer from them. And so our email service is what you can actually do. You can email a doctor specifically and they will give you your own answer. So it's not just a generic answer for people, but it's an answer that's tailored to you. So for instance, we have dietitians. And so let's say you've been, you got the freshman 15 or the sophomore 60 or whatever while you're at school and you want to start a new nutrition plan. You can write in and talk to a dietitian and they will give you a customized plan for your for your goals. If you are just recently diagnosed with an illness and you need to adjust your diet, they can give you a personalized plan for your illness. So we have 9 different specialists. They include psychologists, they include pharmacists, and if you have children, pediatricians, just to ask questions. It does not take the place of seeing a physician or anything, but it is good for getting advice on certain things. Okay, so how do you register for it? First thing you would do is you would go to the University Health Services page. We have a couple different ways that you can get to the next form. The first way is to go to the University Health Services page. You're going to scroll down until you find our graphic and the logo. That gives a little bit of a blurb as far as what it is, and then you would click here to connect with one of our telemedicine doctors now. Or there's a landing page that was created specifically for TSU that you can access mobile or of course on your laptop or tablet. You can go to the landing page and you will click register now, and there's landing page address. We can get all this information to you in a document. And then what that will do is take you to the Hipaa authorization form. And so basically what that is a form that says that it's okay for the company to share information with Tennessee State University. And so that's what that form is for. And it must be filled before you can actually register for the service. After you register and fill out this form, then it'll give you instructions on what you need to do in order to complete your registration. And what that entails is logging into your member portal, and I'll show you what that looks like. And that's where you can schedule consults to see doctors from the member dashboard. That's where you can also send emails as well. And so there's 2 different ways to schedule an appointment. Our doctors call back. They're guaranteed to call back within 2 hours, but most of the doctors call back, almost as soon as you hang up the phone to schedule you an appointment. So our average time is about 19 to 23 minutes, by the time you finish with your consultation. So this is something that is very, very convenient and very, 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 very time efficient as well. Okay, so I'm going to switch screens here just so that you can see. See this. Okay, can you see that? Okay. This is what you'll see when you get ready to log in to your patient portal. And once we log in, this is what the dashboard looks like. So you'll have to enter all of your medical history right here prior to a doctor seeing you, which of course makes sense. They need to know about your medical history and review that before they call you back so that they can have a clearer picture as to, you know, what's going on with you, and then certain things that medications you can take, medications you can't take if you're, you know, if you have any medical issues. There's certain things on here that this is just a demo portal that our service can do a little bit more of. So it'll look a little bit different for you because you won't have a few of the options here, like to speak with a counselor, because you guys already have the University Counseling Center there to supply the, you know, your needs in that aspect. So this is just a general overview of what the portal looks like. And it's very easy to navigate. You just click through, you say you want a consultation, and then it walks you through the whole process. You can also, once the consultation has been done, you can download the records so that if you have a doctor back at home, you can send that to them so that they will have kind of a continuity of care. The providers at TSU can also see those consultations so that if you need to follow up and go back into the University Health Services, they can see what was done for you before, but they can also follow up with you after your visit just to see how you're doing as well. Okay, so sometimes the doctor may say, hey, you need to be seen at a hospital, or maybe you need to go to urgent care because we can't treat it over the phone. That rarely happens unless, you know, you have a cut or it's something that you say that's a little more concerning. So Dr. Davis, Dr. Ivan Davis over the University Health Services really wanted me to stress that if they tell you to go to the hospital, the first place that you should try to go is Metro General Hospital. Primarily because they will work with you as it comes to payment and things like that. So it would, and then secondly, it's closer. It's the closest hospital to TSU. Okay, so what we do not treat emergencies or mental health crises. You guys have a great counseling center there on campus with Miss Kennedy. We are providing the ability for the University Counseling Center to have telemedicine visits with students. And so we are providing that platform for the University Counseling Center. We do want you to know where you can go and where you should go if you're having a mental health crisis. You should not pick up the phone and call emergency MD to try to schedule an appointment. We don't have behavioral health, but these are the 3 avenues that you can use to get service if you're having a mental health.
And Ms. Kennedy, I think she's on the call. So briefly, okay, before we end for the day, if she'll just take a moment and talk about what they can do so that there'll be clarity around telehealth and when they need to contact the counseling center.
Okay, good. Okay. This is the information that you can use to call in the case of an emergency. So just remember, my urgency MD does not handle mental health emergencies at all. And this is just a repeat. And so what you'll see is our campus director. She'll be on campus, you know, making sure that she is all COVID-19 proof. She has more information about the services, and then she's also there to help you sign up. So This is, and if you have any questions, she's able to reach out to you as well, and with the answers to your questions. All right, so how you can get started, you can either go to the health center website, scroll down and click, click here to see a doctor now, or you can go to the landing page, which is myemergencymd.com, Tennessee State University, with hyphens between Tennessee State and University. We also have Facebook pages, a Facebook page and an Instagram page. These pages will give tips and pointers for just different topics as well. It'll talk about the services and when they can be used. So if you'll go ahead and add those to your social media, we would greatly appreciate it. And if you have any suggestions, then we can also talk about specific topics if you would like to suggest any topics as well. And so that's the end of my presentation. I see that there is some chat. Is there some chat questions?
Yes.
And if you don't mind, Dr. Davis, maybe I can take a couple.
And I've been answering them.
Oh, okay.
In the chat.
Okay,
so,
well then that's cool. If you've been answering.
There's a lot of great questions. So we'll go over the first one. Is this a free service or will it be filed through insurance? This is a free service. The university did provide this for the students for the fall semester. So we're excited about that. With the COVID relief money, universities were supposed to try to find ways to add social media platforms and to relief from COVID. So this is not a cost to the university students at all. So it's absorbed, just like if you went to the student health center or the library or some of the other amenities that you get by being a student. So we're excited about that. The next question you have is, when creating an account, will the students use their TSU email? I think that would be good for to use your TSU email, because this is a service provided by Tennessee State University. We want to make sure that it's not somebody else in your family using your student provided telemedicine services provided by EmergencyMD. So using your Tennessee State University email address would be great. Will students log on to their account with Tennessee State University to access EmergencyMD? No, not yet. This is an adjunct service. And so you have to make your own login with your own username and your own password, because it's HIPAA protected as well. So we'll make sure that it's all encrypted. And so that is something that we can be in development with if the university thinks that that needs to be something added into your own student portal as a student. I think that that would be something that we could look into for next semester. Can one opt out of sharing info with TSU? No, you cannot. This is continuity of service. And so the student health services that are already provided at your university are using this to ensure that you have access to healthcare after the University Health Services Center has closed on the weekends, and if you're traveling and if you're not on campus. And yes, the service is provided year round. With continuity of care, the amazing thing that Tennessee State has done for you is to make sure that there's always an ability for you to have access to a doctor. And so the doctors at Tennessee State University are the licensed professional that are going to be integrating and making sure that there's good continuity of care. So you cannot opt out from Tennessee State University having access to at least following up with you on your doctor visits that you do in this virtual platform. So those are the answers to all of those questions so far.
Can I clarify just a bit, Judge Bell, if you don't mind, because I can see this being an issue of concern for students. So myemergencymD is working in partnership in tandem with the University Health Center. So it would be, as if you were seeing someone in the University Health Center, but maybe you don't necessarily need to go to the health center for what your concern is. So it's not so much a matter of they're going to call the University Health Center and share your record. But if there's a visit and there's an emergency, or you were referred to the hospital, and we as the university need to follow up for your safety, we need to know that that has happened. So the continuation of records is more for that, because it is a Tennessee State University service. So it's not like you went to Walgreens, right? And then they're sharing your information with the university. This is a service being provided by the university in additional support to the University Health Center when the University Health Center is not available, when it's not open, when it's weekends, so on and so forth. So I just, I want to be clear because folks can get concerned about, well, what do they know? And, what if I call and I don't want you to tell what happened, so on and so forth. You can absolutely say that. And so that's been documented and clear for the record. But that doesn't mean that we still don't hold the responsibility for you as a student of Tennessee State University. If something happens and you were referred somewhere and we don't know anything about it, we're responsible for that. So that's why that's in place. And I want to clarify why that's in place in the way that it is. Sorry for the interruption, Judge.
No, yeah, those were all really good questions. And I just want to make sure that, this is clear. This service is going to be very valuable, or a proof that it's going to be valuable to the university, but we also want it to be valuable to you guys. We want you to use it and give feedback or anything like that for it, because this is going to be a great service and a great partnership with Tennessee State and for its students.
We have another question. Does a student need to be registered? Yes, you need to be registered because the university is paying for students that are registered to have this service, just like using the University Health Services Center. What other ways are your services limit not mentioned? Okay, I'll refer that to Dr. Dorsha.
Well, I'm not sure I really understand the question. Repeat.
On the portal you showed, you said some of these are not specific to Tennessee State University because they have their own university counseling center. I know Ms. Kennedy's on the call today, so maybe she can give some insight.
Yeah, I didn't want to confuse you by just showing the portal with not saying that the talk to a counselor, that panel won't be on your panel when you pull it up. So I didn't want you to pull up the panel thinking that you're going to talk with a counselor from there because you're not. That whole panel just won't be there. So we don't have the behavioral health. That's not offered. And then we don't have the patient advocacy. That's not offered as well. So those two things, if you saw them on the portal, those won't be on TSU's portal. It'll just be message a specialist and the telemedicine.
Right, so we don't have any other questions at this time.
And I'm gonna have Rachel put my email into the chat. If you guys have any questions that you want to ask me directly, you can just email me. You can also email contact@myurgencymd.com as well. So those are two email addresses that you can use. If you just have a general question, you can email contact@myurgencymd.com. Or if you want to talk to me specifically, you can email me directly at drdorsha@myurgencymd.com. Okay, and so I'm gonna, go ahead.
This Friday, Courtney Johnson, who is our Director of Student Engagement, will be on campus at the University Center. So if you want to stop by the table and get some flyers or get some information, you're going to start seeing more information, hopefully in the dormitories and on the teleprompters, the TVs that are posted around campus, so that you can have more information and more insight on how to register for MRGCMD and how to use it. I know many of you are probably thinking, I don't need this right now. I don't need to register for it right now. But when you have that urgency come, you're going to want to have, that you're already registered so that you can have it immediately right there at your fingertips. I do have a question, more so a comment. Oh, thank you. This is an amazing service. Very nice asset for the students. Thank you. Well, good. Well, thank you. And I'm always bragging about Dr. Dorsha. She was one of the first, not one of the first, she is the very first African-American female that graduated from Vanderbilt's residency program for the emergency room. And several years ago, she decided that she wanted to step away from the ER and create a telemedicine company. Like she said, she saw too many people coming to the ER with these enormous bills just for minor urgencies. And so she did a lot of research to find a network of doctors to create her own telemedicine hospital. So this hospital that y'all are getting, MRGCMD Telemedicine Hospital, y'all are the first HBCU to have it, which is exciting. And not only that, that's dope, right? Not only that, but this is all around the United States of America, all 50 states plus Puerto Rico. So y'all are going to be hearing more and more about Emergency MD. You know, it's Black owned, supporting the institution. And so we wanted to give this to HBCUs first. We didn't even pitch it to any other colleges or institutions because we know that this is something that is very important, and wanted to make sure that you had first dibs and opportunity to it first. So we're thankful for the collaboration and the partnership. And this is something that we want to hear from you, that is going well, or there's some glitches, or there's some, you know, some things that you think that we can do to help navigate even better. So Dr. Dorsha will be doing some house calls with y'all on the weekly basis. We're going to hope that we can have this same platform weekly where we won't be talking about telemedicine per se. She's just going to be talking to y'all about medical issues and things that you may be coming up with. So check out the social media pages, Instagram and Facebook. There's a lot of tips, a lot of information there. Don't Google a doctor. Y'all have access to board certified doctors no matter where you are 24/7. So you don't have to wait. And like you said, you just have a question, message the doctor. They respond pretty quickly. So we're excited. We're going to grow with you. We want to hear from you. Tell us how it's going. And we'll make those shifts, make those changes, and make sure that you're happy. It's a mutually beneficial relationship that we want to have with you. So thank you.
I also want to add, Judge Bell, if you don't mind, I wanted to add also, there's an educational and outreach component that will be available via My Urgency MD as well. So there'll be opportunities for information provision or education. As you guys know, the health center it tends to be overwhelmed. We're in the middle of a pandemic, so obviously staff is not able to do typical outreach and education, things that we would do around, you know, STDs, pregnancy, things like that. And so My Urgency MD will also provide a platform for those type of activities, workshops, outreach, things like that around information, medical information, information about the pandemic. I mean, all sorts of things that tie directly to that. So it'll also be an educative piece as well. I don't know if you mentioned that early on and I missed it, but I wanted to make sure, because our student leaders are on the call, they may also, you know, want to use this as a component of a programming platform or something where they want to get information out to students. And I want them to know that you all are available to support that as well.
Right. And also, if you have any suggested topics, now I have a multitude of topics that I can talk about. Like I said, I've practiced emergency medicine for 15 years. So if I haven't seen it, then it probably hasn't been done. So, you know, a variety of issues, a variety of topics or anything like that. Like Rachel said, we had already planned on doing. But if you guys just know of something that you want to talk about, that, you know, that you want to hear about, or to ask me to speak if you guys are having an event, and to have me speak somewhere or have us come and do a presentation about something other than telemedicine, just reach out to us, that contact at myemergencymd.com, and then we can try to get a presentation together for you. You can tell us how many people, when, where, etc. But that's what we're here for. We're here for education. We're here for outreach. We want it to be more than just us providing this service to you and then you don't hear anything else from us. So that is the goal as far as this relationship goes with TSU. So thanks for mentioning that, Dr. Davis.
And then after this pandemic, and maybe even amidst the pandemic, we want to get, you know, on campus and be in an auditorium with you and just answer some of the questions that you may have. I mean, there's a lot of things that are going on in your life. And we remember being in college, and we remember what it feels like. And so not many things have changed. College life, not many things have changed, but y'all have access to technology. And so being on the cutting edge of this new model that wasn't developed just because of COVID-19, but, you know, it's time. The timing is perfect. And so we're excited about that. So Dr. Davis, we look forward to getting on campus by Zoom for those presentations or in person. So we'll get that calendar together. So we're excited about that.
Yeah.
So
yeah, and also just to make mention is that Dr. Davis alluded to this before, is that we do this in conjunction with the University Health Services. We're kind of like an arm off of the body of UHC, I mean UHS. And so, I've talked with Dr. Ivan Davis, about some topics that we could talk about and things like that. So we do this as an extension of outreach from the University Health Services and Student Health Center. So, we're just coming in as like the little sister, little can't say little brothers, but little sisters to the clinic.
Okay, so I don't see any other questions in the chat, but Dr. Dorsha and our Director of Engagement, Student Engagement, will be on campus on Friday, working on a few things. I don't know what time they're going to be over there, but Residence Life. Are all the doctors Black? No, they are not all Black. However, this is a Black-owned company, and so there are doctors from all walks of life, but they're all board certified. And they're all amazing doctors that have telemedicine certification, but they're not all Black.
And you know what, I forgot to mention this, that we had our doctors, you can get a consultation in English or Spanish. So, you may want to speak with the physician in Spanish. That may be your primary language or your second language. So all of our consultations, all of your consultations can be done in Spanish as well. So we have a complete Spanish platform available for that. So that's another benefit.
While Ms. Kennedy is on the line, I'd also like to just take a minute so that she can talk briefly about how mental health services plays into this, and you all can talk about how the platform will be used both to support but also separately from counseling services. I just want to make sure that that's clarified so that our student leaders are able to convey the information correctly. Ms. Kennedy, do you mind taking a second and just speaking about that?
Yes. Yes. So the way in which the services will be supported for the University Counseling Center will be for non-urgent, so not crisis, but non-urgent concerns that may arise during evenings and weekends, in which it doesn't need to be something that's referred to our crisis response line, which is initiated through TSU PD to reach the therapist on call, as well as this would be available during breaks, like we have our upcoming winter break, which is a little bit more extended than we typically have. So anything that's non-urgent that occurs outside of our regular hours, this would be an opportunity to still speak with someone and receive support, and also have it referred back to the counseling center for follow-up.
Awesome, thank you. Are there any questions as it relates to that? All right, good deal. All right, well, if there are no further questions or further discussion, I think we can wrap up.
Yeah, well,
that works for everybody. Any final points or points of information, if you want to put it in the chat? I believe the meeting is being recorded, so we can always make sure that students have the information afterwards if necessary.
Well, so we really appreciate the opportunity. We look forward to not just working with administration. I can't wait to work with the students as well. It's been, I won't even say how long it's been since I've been in college, but it feels like it was just yesterday. And so we want to kind of bridge that gap. Telemedicine and medicine doesn't have to be this island over than health services where, it's just kind of there when you need it, as opposed to, education and outreach. So I look forward to meeting everyone, and hopefully this pandemic will lift and we can meet in person, and Emergency MD can sponsor some events, and we will be excited to do that. So thank you guys for your attention. Thank you for your great questions. If you need me, just email me, and that's it from me.
And I'm always plugging. I'm the hype person about everything. I'm one of the most exciting people you're gonna meet. But I'm excited about y'all get engaged. So when Dr. Dorsha does her house call and does these, like Dr. David said, and we're working with the University Health Services Center to talk to you about just various different things going on in the life of your body, your human body. Sign up, get engaged. So we have about 36 people on the call today. That is great. And then share the information with your friends, with the student body. Let them know about it, and don't wait to register. Go on and register. Go on and get everything that you need, and brag about it. See if your friends that go to another college has it or not, if they have access to it or not, because you're going to be able to brag about what your university is being able to do amid this pandemic. This is an amazing opportunity. You're going to remember this when you get a little bit older. I've been in college 20 years, so I don't mind saying my age, but 20 years ago I was in college.
I wanted to add on and piggyback just a bit. I'm sorry, Dr. Dorsch, I didn't mean to interrupt.
Okay.
But I do want to say, please go ahead and register now. It's a bit of a process, some paperwork, some questions, and I would rather you have that done than need to access the service and have to take the time to complete the registration before you can go ahead and get connected to a physician. Depending on what you're needing, you'll probably want an answer or someone to speak to sooner rather than later, and you'll have to do the registration process on the front end. But if you do it now, then it's done. And whenever you're ready to use the system, it's just available for your use. So it's up to you. But for folks who have been sick before, really sick, the last thing you feel like doing when you go to the hospital is filling out the insurance paperwork, right? It's signing all the stuff, and you just want to see somebody and get your needs met. So this is the same thing. When you're not feeling well, the last thing you're gonna feel like doing is answering questions, going to the next page, answering questions. You're gonna want to be able to get to the person who can help you as quickly as possible. So I'm just encouraging you, if you can, if you got 5 minutes, go ahead and register now, and you'll have it done.
Yes. And all I was going to say was there'll be some surprises throughout as we go along. So just keep an eye out for us, and I guarantee you guys won't be disappointed. So, all right, that's it for me.
Okay, any questions for any students? All right. Thank you, Dr. Davis, for getting us on the call with the students. Y'all stay encouraged. I mean, y'all, keep studying, do what you need to do. Know that this too will pass, and you'll be able to talk about this several years from now, that you were, in college during COVID-19. And so the election's gonna pass, everything. I'm spiritual, so God's will, and y'all just stay safe and keep going.
Absolutely. Y'all, we got 2.5 strong weeks left. Let's finish strong. I believe in you. I'm excited for you. Let's finish strong. If you need the support, you have it. Thank you, Dr. Morgan, for the platform. I appreciate him coordinating the call today. And that is all. Go Big Blue. All right.
All right.
Thanks, everyone. Bye-bye.